Everyone, I am Srijoni Rabha from the Royal School of Communications and Media. It is my pleasure to welcome you all to the unique event. I am delighted to invite you to our menstrual hygiene awareness and interactive session. We are thrilled to have you all here today. This event marks an important step in educating and empowering ourselves about menstrual safe environment for all. I would like to take a moment to welcome HOD RSCOM, Ms. Florence Hendrik Rabha ma'am, Dr. Suresh Chandra Nayak sir, Professor RSCOM, respected faculty members, and most importantly, our honorable guest speaker of the day, Dr. Judy Bordoloi ma'am. Thank you all for your gracious presence. In today's event, it is my privilege to invite our esteemed head of department, Ms. Florence Hendrik Rabha ma'am, and Assistant Professor RSCOM to deliver the welcome address. Please give a huge round of applause for ma'am.
Honorable Vice Chancellor, sir, the Assam Royal Global University, Professor Dr. Sanjay Pratap Singh, sir. He could not join us because he has a few meetings. He has few meetings to attend now. And respected Dean, Royal School of Communication and Media, RSCOM, Professor P.J. Mohanta. He's not in campus today, I believe. And Professor Nayak. Suresh Chandra Nayak, dear colleagues and my dear students. A very warm good afternoon to everyone. On the very outset, I wish you all a very meaningful Menstrual Hygiene Day 2024. Menstrual Hygiene Day is an annual awareness day celebrated on May 28th to highlight the importance of good menstrual hygiene management at a global level. Now, Menstrual Hygiene Day was started by Germany-based NGO WASH United in 2013. When a 28-day social media campaign was launched to spread awareness around different aspects of menstruation. Now, the theme of Menstrual Hygiene Day 2024 is Together for a Period-Friendly World. In a period-friendly world, the stigma and taboos surrounding menstruation are history. It is a world where everyone can access the products, they have an access to period education, and period-friendly infrastructure they need. So I request all the boys and girls and our dear faculty members to join the movement and help create a world where women and girls are no longer held back because they menstruate. Together we are louder. Together we strive for a period-friendly world. I hope all of you are aware that poor menstrual hygiene can pose serious health risks, right? For instance, neglecting to wash hands after changing menstrual products can spread infections. So there are many more things you need to know, and we need to discuss openly about all these issues, do's and don'ts related to menstrual hygiene. That's why I have invited my dear friend, a renowned and efficient gynecologist from Apollo Excel Care Hospital, Dr. Judy Bordoloi. I have known Dr. Judy for the last 2 decades. We are neighbors, we live in the same colony, and I'm really very thankful to Dr. Judy for joining us in spite of her hectic schedule. Welcome, Dr. Judy, to our GU campus. I would also like to welcome 3 esteemed officers who have accompanied her, to our GU campus. Welcome, sirs. Our students and faculty members are very happy to have you amongst us. So, dear students, I won't take much of your time. Wishing you all a very fruitful and informative session with our esteemed guest speaker for today, Dr. Judy Bordoloi. Thank you.
Very much helpful and knowledgeable. Now, I would like to request Dr. Suresh Chandra Nayak sir, Professor RSCOM, to address the room. Please give a huge round of applause for sir.
So, a very good afternoon to one and all present here. Our respected Chancellor, our Vice Chancellor, Professor S.P. Singh, the head of the department, Ms. Florence, and our invited speaker of the day, Dr. Judy, and 3 officers who came along with Dr. Judy. They are also welcome to this interactive session. because being a male, I have nothing to say on this issue because we have invited a very senior gynecologist who is going to deliver and interact with our kids. And why we have also joined, because we are all family men. We are also blessed with daughters, we are blessed with sisters, so we should have also the knowledge. So having knowledge about something is not bad. So as Ms. Florence already said, that I wish you all a menstrual hygiene day today. And I hope this 1 hour interactive session is going to be more beneficial for our students, both for the boys as well as girls. Because one thing I remember, there is no substitute to women. As there is no substitute to mother, like that there is no substitute to women. So women is more and more and more precious because they are the creature. They are the creators of this universe. So we should know how to take care of it, and we should know, and we should, being a journalism student, we should also know that how to create awareness among the people, those who are not aware of these do's and do nots of the menstrual hygiene. Many people, there were movies also on that. I do remember there was a movie of Akshay Kumar, Padman. So people, they hesitate to say, but now the situation has changed, now the society has been changed. So the girls, they never hesitate to say anything. During our days, I do remember I was a student of literature, English literature. So we were also girl students and our friends. So now things have been changed, and they don't hesitate to say that we are having this problem or that problem. And I hope, because I'm not going to take much of your time, as we have already invited Dr. Judy, and I hope this 1 hour session is going to be more interactive and more insightful for all of us. And thank you once again. Jai Hind and Jai Bharat.
Extremely honored to be introducing our guest speaker of the day, Dr. Judy Bordoloi ma'am. She has quite a lot of achievement to her name, and I'm not sorry if this takes a while. Dr. Judy Bordoloi, a distinguished gynecologist and oncologist, began her medical career as a junior resident medical officer at Safdarjung Hospital, New Delhi. She further honed her expertise as a fellow in gyne-oncology at Tata Memorial Hospital, Mumbai. Her professional journey includes significant tenures as a senior resident at ESIC hospitals in both New Delhi and Guwahati, as well as at B. Bordoloi Cancer Institute in Guwahati. She then served as a junior consultant at Marwari Maternity Hospital, Guwahati, before becoming an assistant professor in the Department of Obstetrics and Gynecology at Guwahati Medical College and Hospital. Additionally, Dr. Judy has received specialized training in laparoscopic gynecological procedures in Ahmedabad, Gujarat. Dr. Judy holds prominent positions in professional societies, including Secretary and Treasurer of the Guwahati Obstetrics and Gynecologic Society, and Treasurer and Executive Member of the Scientific Committee for the All India Conference of Obstetrics and Gynecology. She is a founder member of both the Northeast Cancer Association of India and the Guwahati Menopausal Society. As a master trainer for sterilization programs and cervical cancer screening under the Ministry of Health and Family Welfare, Government of India, she has contributed extensively to public health. She has organized numerous women's health and screening camps across Assam and have been invited as guest faculty and chairperson at various national conferences. Her scholarly contributions include numerous publications in national journals. Ma'am, we are truly honored to have you among us. I would like to invite you on stage, and I also request Florence ma'am to felicitate ma'am with a small token of respect and appreciation. Please give a huge round of applause for all of the members. Everyone. On this occasion of Menstrual Hygiene Awareness Day, we went out to explore various mindsets and thoughts as we questioned students and faculties about the topic of the hour, menstrual hygiene and health. Here presenting you the answers we received.
Menstruation and menstruation hygiene. So tomorrow is a very important day. It's 28th of May, we celebrate Menstruation Hygiene Day here at Royal Global University. Menstruation is a natural process, but the diseases which are associated with it, it is actually the mindset of the people that matters. We all people should understand that why certain girls suffer from diseases, because they do not maintain hygiene, and we should be aware about every man and boys especially should know about what menstruation is. What are the basic things that are required for a woman during menstruation? I think they need a little more care, and they also need rest, because at that time they are very good.
Just comfort you. I don't really expect anything.
We expect them to be patient and them to be helpful in the daily work activities or indoor activities or outdoor activities.
What message would you like to give to maintain the hygiene during menstruation?
To daily wash up and to always change their pad like after 4 or 5 hours. Then to help them have a healthy period time often.
Thank you. Do you think it is safe to do intercourse during menstruation cycle?
I believe no, you should always wear protection stuff.
Have you ever heard about menstruation?
Yes, well,
What do you think menstruation is?
well, I cannot really explain it. I think you should ask somebody else.
So you must have heard about it, right? Like, what do you think it is? Basic idea. Or period.
Yes, I have heard about it.
What does go through the people?
Well, I don't really have a clear idea. I don't have any idea, to be honest. So, you should ask somebody else.
It's a cycle that occurs in a female reproductive system. It's either once in a month, from what I know.
Do you know about the diseases that are associated with menstruation if one does not maintain hygiene?
No.
UTI, have you heard about UTI, urinary tract?
Yes, that I have.
Tomorrow we are celebrating Menstrual Hygiene Day. It's 28th May. We are from Journalism Mass Communication Department. Ma'am, I want to know about your experience, the day when you got your first period. How was the experience?
Okay, sharing my experience on the day when I got my first period, it was quite traumatic because at that time we did not have so much of an open, communication with our parents. We got to learn from our friends that something of this sort happens, and then on top of that, I was in my relative's house, and then there was a ritual in Assamese custom, Lonibia. So that was again for me, I did not like that ritual from the very beginning because the girl was secluded, the girl had to be had to be under controlled food and everything. Of course there are scientific reasons for that, but still since I was a child, I did not understand the rules, but now I understand them better, of course.
Purva Compassion problem for women's or Mahika Mansa Mandai, and Makita receiver. But I'm going to problem receiver.
এইবিলাক কিছুমান টাইমত চাগে দেখো মই পাইছোঁ মই নামানো বহুত জেগাত বোলে কাৰণ যেতিয়া বাহে মা কেতিয়াবা মেনষ্ট্ৰুৱেশ্যন চাইকেলত বোলে মানে ফেজ থাকে সেই টাইমটো মানে এনেকুৱা হৈছে আমাৰ ঘৰত কেতিয়াবা মানে বাছ লগৰ মানুহ চোৱা এনেকৈ টিভি চাই নালাগে তো তেনেকুৱা টাইপৰ এটা ষ্টিৰিঅ'টাইপ এটা আছে বোলে মানুহৰ
Okay, periods. So any idea like first day में आपका experience कैसा है?
Oh my god, first day of my period it was very terrifying. I remember I got my periods when I was in class 5, which was quite unusual depending on the time during my time. Class 5 में periods होना थोड़ा सा unusual था. I had no idea about what period was and all of that. So it's a gross information, but the first periods are not blood. It's basically dark red in color. It's brownish. It looks like dirt.
नहीं तो आपके फादर से आपने एक्सपीरियंस क्यों शेयर किए मम्मी के साथ ही क्यों
I think it is because of the conservative nature that we're in. That पापा को नहीं पता लगना चाहिए, ठीक है? पापा नहीं, भैया नहीं. That is the main idea of it. So yeah.
तो और अभी का क्या ये कॉमन हो गया कि अभी भी वैसे ही चल रहा है कि नहीं लड़कों या फिर फादर्स के साथ शेयर नहीं करना चाहिए only mom या फिर girls के साथ?
I think now the situation has drastically changed. Like I talk with my male friends about period. We girls can loudly say, "भाई मेरा period हुआ है, मेरे साथ मत कर." ठीक है? It has drastically changed. We have normalized. अगर कोई बोलेगा कि we have still period, the word period is not normalized. It has been normalized. At least here, I see that it has been drastically normalized.
So this was a little effort made by the students of RSCOM, and special thanks to to Mujahidul, Vishal, Keshav, and the editor Matthew. Thank you so much for your efforts. Now, without making the audience wait any further, I would like to call upon Dr. Judy Bordoloi ma'am to enlighten us and
HOD, Mrs. Florence, Handik Rabha, for inviting me here. Nice to meet Professor Nayak and Ms. Rashmi and all other faculties as well as students here. So, as you know, I work in Apollo Excel Care Hospital, and few tips that I would like to share today on menstrual awareness and hygiene. I think ma'am has already mentioned about today. Why are we celebrating it, and what is the May 28th, why is it significant? Now, this day, the Menstrual Hygiene Day, has been selected as 20th May. Why? Because on an average, the menstrual cycle lasts around 28 days in length, and women on an average menstruate for about 5 days each month. Maybe 7, but average is 5 days. So that is why we have celebrated Menstrual Hygiene Day as May 28th, because 28-day cycle, and May is the 5th month of the year. So it was started by Germany-based NGO Wash United in 2013, as Madam has already said, Florence Madam has already mentioned, when a 28-day social media campaign was launched to spread awareness around different aspects of menstruation. And motivated by the positive response around the campaign, this Menstrual Hygiene Day was observed for the first time in 14 with rallies, exhibitions, workshops and speeches. And that is what we are continuing to do so in this last 10 years, from 2014 to 2024. And also, Madam has enlightened us on the theme of this year's day, Menstrual Hygiene Day, that is Together for a Period-Friendly World. And here the stigma and taboos surrounding menstruation are history, and everyone can access products, education and also the period-friendly infrastructure. And that, as already I have seen in the video that was made by your students, where they were saying about some kind of taboos which is very often seen in our society, especially in rural areas also, and sometimes in urban areas also. And the taboos are actually myths, so to say, because they would tell you that a woman is impure during this time, not to touch food or pickles because they will become bad, or not to touch the other person, not to offer prayers, not to do much hard work, not to go for temples or any other religious institutions. So all these are actually myths, because it is a normal natural cycle of the woman. But of course, if some women do not want to go to the temple, that is because to respect the religious sentiment of the others. But the other things like going to work or touching this, touching that, those are all myths. Nothing happens or nothing bad happens due to menstruation. Now we are realizing this in the society, and from the video you have already seen, many do not know about it, and others have seen some changes in it. So first I would like to tell you the definition of menstruation. So the normal monthly shedding of blood and tissue from the lining of the uterus when pregnancy does not occur. So that is menstruation, and it comes from the Latin word mensis, which means month. And the period, it is also called period. Now period comes from the Greek word peri and hodos, means periodos, meaning around and way or path. This eventually turned into the Latin periodus, meaning recurring cycle.
Now, the English term period to describe menstruation began in the early 1800s in the European society and in the American society. Menstrual awareness is important because it builds confidence, it contributes to social solidarity, and also encourages healthy habits. So what happens? During menstruation, the menstrual blood and tissue flows from the uterus through the cervix and pass out of the body through the vagina. And menstruation begins at puberty and ends at menopause. And it is under the influence of a lot of hormones like estrogen, progesterone. Then there is another hormone called LH, which causes ovulation. So ultimately this cycle is influenced by the hormones in our body, which is of course different in different women. And any imbalance in these hormones can lead to some menstrual disorders. So no woman is the same, isn't it? All the hormones are different, the genetic constitution is different. So every period is different for each woman, whether in the length of the cycle, or whether in the flow, whether the color, it is different. But all are normal. Within a specific, what we specify in gynecology, all are normal, except some other conditions which we will mention later. So the menstrual cycle most commonly begins at puberty among women, that we all know, and it commonly belongs to the age group of 8 to 15 years, an average age of 12 years. It mostly begins after 2 years of breast and pubic hair development at puberty. So these are the common symptoms that you all see during menstruation. Most common is the pain. And there are other symptoms too. Pain occurs almost in 8 out of every 10 women. May be mild, may be moderate, may be severe. May need medication, may not. But there are other symptoms too. Not all women suffer the same symptom. There may be headaches, abdominal pain, acne, back pain, swollen breasts, and nausea during the day starting before the period and also during the periods. First 2-3 days we all suffer from this. Altogether these symptoms are called the PMS symptoms, the premenstrual symptoms. And sometimes we are affected psychologically also. We may be irritable, we may have mood swings, may have anxiety, depression, and not a sort of inability to work, because we tend to lose our focus either with the physical pain or because of the irritability. We don't want to focus on the work. So of course for this kind of PMS symptoms, all of us are suffering in one way or the other, maybe mild or severe. But we can have some relief with some treatment, mild treatments, like you can take a warm shower, or you can take a hot water bag that we all know, and cover the hot water bag with a towel or a gamusa, and then you put it on the lower abdominal area to relieve pain. And also on the back, you can use it on the back. So this is a very good method to use it. And also some girls may need mild analgesics for the same, to relieve the pain, because it may be severe. They may have classes, they may have exams, they may have important events. Then you may need to give some analgesics, mild analgesics. And sometimes there are other vitamins also for PMS symptoms, which we give to girls and women. And if at all it is not relieving, then we also have to go for the hormonal treatment. So that time, if you feel that your symptoms are more severe, then you must consult a gynae doctor. Also try to eat healthy food during that time, and also take a lot of water, because hydration is important during this time. Hydration means taking water or lemon water, or kind of herbal teas, or coconut water which has got water and electrolytes. So hydrating yourself is important, and avoid too much of sugar, avoid too much of salt during your period. Even salt, it causes water retention in the body, so you kind of feel bloated. So that is why try to make it less, both the salt and sugar. So after the symptoms, I can tell you a little bit about this foods you can prefer during menstruation. Like, you can take your proteins, no harm. Chicken, fish, egg, dry fruits, nuts, they're all healthy. Even dark chocolate has some good hormone in it, and a good quality dark chocolate which has more than 70% cocoa, you can take that. And fruits and vegetables, I need not say more. It's very important. You must take. And even water, as I suggested before, not only hydrates you, but also prevents urinary tract infection. So these are the simple foods and water that you need to take during your periods. And foods to be avoided, as I told you, excess of coffee. Avoid excess coffee, alcohol, and cut down on your carbs. Refined carbs means junk food and fast food, and also red meat. Okay, and salt I had already mentioned. Then 3 simple yoga poses for relief in menstrual cramps. I'm sure you have done a yoga class today, as I saw in your agenda, and I'm sure all of you have learnt all the techniques, but you go for the simple things like asanas. I'm sure you have been told, but these 3 simple yoga poses can bring some relief in menstrual cramps. But don't do a headstand, like, going ulta all over. A headstand not required. Excessive gymming not required. But light walking, exercise, daily activities is important and essential to do, unless you are suffering from so much pain that you have to be bedridden. Okay, otherwise you can go about your work. Then these are the materials used during periods. I'm sure all the women are aware, all the girls are aware, and even for education of the boys, it is important. The menstrual cloth, as you can see, these are reusable, because in rural areas, women do not have access to sanitary napkins the way that we do here in cities and towns. So this kind of menstrual cloth, they're made of cotton fibers. They keep on washing it, and washing is also important in salt water in normal temperature. Then wash in detergent and always dry in the sunlight, because it kills all the germs. And the poor women, they also cannot afford to buy sanitary napkins in rural areas, so they need to have some kind of cloth or pad for use. So that is what they do. Then also some kind of reusable pads are also available. And the other pad that we all know are the sanitary napkins, which are available. We are spoiled for choice in today's world with so much of sanitary napkins. But they are hygienic, they are efficient, they are clean. The important thing to remember is to change the pads frequently. Then there are other 2 types, not very popular, but in some women they use menstrual cup. This is made of medical grade silicone, and the menstrual cup, it is foldable. You can put it in the vagina and it will grip the cervix, and the blood is collected there. So this device, it's a small flexible device which will remain in the vagina and will collect the blood. Now this has a capacity of 15 to 20 ml, which means you can keep it longer, like say 8 hours or 10 hours, if there is a woman with a less amount of bleed, and they are washable. So this kind of cups can be used for as long as 5 to 10 years. And then there is another thing called a tampon, which is useful in some women. But these tampons are made from cotton, and they have a thread hanging out, and that is put inside the vagina. And usually menstrual cup and tampons are preferred in married women, or I would say women who has had exposure, sexual exposure, so that it fits in the vagina properly. But important thing to remember in tampon use is to change it very frequently, otherwise very lethal infections may occur. These are the common menstrual disorders which I'm sure all of you, or at least 9 out of 10, do suffer. Sometimes they suffer the premenstrual syndrome, which I have already told you and showed you the slides. Then what is dysmenorrhea? Dysmenorrhea is also nothing but pain in the uterus. Now it could be a natural pain also, which occurs when a uterus is contracting to expel out your blood, or you may have something called a fibroid, which is a non-cancer tumor of the uterus, or conditions like endometriosis or chocolate cysts which occur in the ovaries. They may also cause pain. So whenever you have these menstrual disorders, then you need to consult a gynae doctor, because we always do an ultrasound to find out if you are suffering from any of these tumors, or kind of hormonal imbalance, or endometriosis, or chocolate cyst, so we can give you the proper treatment for that. And if we find in ultrasound that it is normal, then nothing to worry or panic. And this is very common in the young girls. The pain is the commonest symptom. Whenever a girl starts menstruating from 10 years or 11 years, this is the most common symptom. Then heavy menstrual bleeding is called menorrhagia. So heavy, how do we define heavy? If in medical terms we say more than 80 ml of blood has gone in one period, then we call it heavy flow. But it is difficult to clinically assess how much flow is going for women, because everybody's cycle and the amount of blood is less or more. It depends on each cycle also, depends on your anxiety level, your stress level, and your workload or your hormonal balance. So what we do is, if you feel that your periods are very heavy in the sense you're changing pads every hour, or you have to change like at night also, and you have a long cycle like around 7 days, then you know that something may be wrong, or that is the time when you need to consult your gynae doctor. So that is called menorrhagia. And sometimes what happens is they will have less bleed, but every 15 days you are having period. So that is called menometrorrhagia. Now that is also abnormal. That is not normal. And when you have that, what happens when you have a heavy bleed or you have bleeding every 15 days, it's abnormal, but it will lead to anemia. You know what is anemia? Anemia means there is a lack of hemoglobin in your blood. So that what happens, outwardly you feel you are okay, but you will have exhaustion, you will feel fatigue, you will have lethargy, you will not be able to focus on your studies and other work, whatever you have been given. So those are the symptoms of anemia, along with, leg swelling, hand swelling, pallor that we see in the eyes, or hands will look pale, lips look pale. So that is anemia. So that is the result of, again, this heavy bleeding. And what is amenorrhea? Amenorrhea is another medical term that we use when there is no periods. So if there is no period, first it is the pregnancy that we think of, and next what is the other common thing that is occurring among all girls nowadays? That is PCOD, polycystic ovarian disease, or polycystic ovarian syndrome. Now what happens in this syndrome is there are small cysts which occur in your ovaries, maybe one side or bilateral ovaries, but what happens is that causes so much of hormonal imbalance in your body, and the estrogen, progesterone, our ladies' hormones, will come down, and the male hormone, the androgens, will increase. So what happens when the androgens increase? Then your cycle becomes disturbed. You may not have period for 2 months, 3 months, even 5 months. I have had patients who are menstruate only once a year when you have PCOD. So obviously it's so abnormal. You need to consult your doctor. So why that happens? So why it is very common in the urban areas? Because we don't do exercise and we eat a lot of junk food, which is very common nowadays. It's a lifestyle disease. So you need to change your lifestyle in the sense that you got to walk more, don't use stairs, take the steps, walk more, at least 30 minutes a day for 5 days a week, do yoga, that is very good, and avoid all kinds of fast food and junk food. And also these kind of PCOD will give you certain symptoms also, not only irregular periods, but they may cause you to lose your hair, you may have pimples or acne in the face, then you may have excess facial hair, or in the body, excess hair in the whole body, which you never had previously but you are starting to get, and also hyperpigmentation in the neck areas, behind your neck, and also in the axilla. So, and also you will gain weight, obesity. Now that you're gaining weight, you feel that you're eating so little, but why you're gaining weight and you're not having your period? That means you could be suffering from PCOD. Okay, so this is diagnosed again by ultrasound, and that is how we advise you with a lifestyle change, and we give you certain medications, whether vitamins or hormonal, to bring your cycle back to normal. So you need not ignore these symptoms when you get, and you must consult a doctor. So menstruation can affect all aspects of a girl's life, that we all know. Girls may miss school during their periods due to the lack of facilities or the necessary supplies. Women may miss work if they don't have access to the supplies or facilities they need. Then that is the economics part where it is being affected. Work power. that is reduced. Then health, use of improvised menstrual hygiene. That means if you do not take good hygiene care, then materials can lead to infection. Girls may also suffer from discomfort, endure teasing, shaming, and face exclusion from everyday activities. So it can affect the dignity of a girl's life. And participation. Girls may be distracted or less productive during schoolwork and other activities due to pain, discomfort, and fear of leaks. So it can affect all the aspects of a girl's life. Now we come to menstrual hygiene management, MHM, and that has been defined by WHO as women and adolescent girls using a clean menstrual management material to absorb and collect blood that can be changed in privacy as often as necessary for the duration of the period, using soap and water for washing the body as required, and having access to facilities to dispose of used menstrual management materials. So this is the definition by WHO. Now, what are the tips to maintain your personal menstrual hygiene? So as we all know, we have to use good quality and clean pads or napkins, which need to be changed frequently. If a person with heavy bleeds, please change at 3 to 4 hours. If you have very low bleed, then you can change at 6 to 8 hours. Then wash your hands before and after changing pads. Then wash the genital area at least twice a day with water. And feminine hygiene washes are available nowadays. Now they contain lactic acid. That is a good substance for the vagina and the vulval areas of the woman. Why? Because lactic acid should be present in the vagina of a woman. The lactobacillus, it is a good bacillus which is present in the vagina of the woman that secretes a substance called lactic acid and also hydrogen peroxide. Now that is very useful because that will kill all the bacteria and the virus and the parasite and the fungus, so that it cleanses itself, the vagina cleanses itself, and the discharge will come out and you don't have infections. But women who are lacking in lactobacillus, that good bacteria that we have, if you are lacking in that, then obviously the germs will take over, will attack you, and you will be prone to more infections and white discharge, whether it is foul smelling or watery or curdy, all kinds of infections may come. So feminine hygiene washes help to some extent to keep it under control. Use twice daily during menstrual period, and also you can use it other times also. And another thing is the douching. Douching of the vagina with soap or water or any other substance is not advisable at all. Vaginal will clean itself. All you need to do is to clean only the outside part. And only in married women, sometimes when there is extreme infection or pruritus or itching, that is, and then we give some vaginal push tablets. Otherwise, it's self-cleansing. Use the washes, that is important. And it is important that our vaginal pH is always acidic. When it becomes alkaline and you lose the lactobacillus, then you are infected with all these germs, the bacteria and all the viruses, they come over and take over. Then drink enough liquids, we had already mentioned, to prevent urinary tract infection and to keep yourself hydrated. Dispose waste material wrapped in toilet paper, tissue or old newspaper in a trash bin which is with a covered lid. Never in the toilet. Don't flush it down the toilet or the commode. They're going to clog the pipes. Some institutions have incinerators for disposal of such waste. All hospitals have incinerators, because not only we have to deal with this diaper, we have to deal with the adult diapers, with baby diapers, with even as things like cotton and gauze, which are soaked in blood and infected material. When you come to our hospital, do a simple dressing. You are thinking it's just a simple dressing that I am going for. But the incinerator is in use because this infected material or the dressing that we have done, we have to dispose that gauze also properly with incineration. Incineration is a procedure where you have to apply a lot of heat is there, beyond 800 degrees centigrade to 1000 degrees centigrade, to burn the materials without polluting the environment, because methane gas is not produced. So that is why the environment will be less polluted. So in hospitals we do have, I'm sure some schools may also have that incinerators. It is essential. in these big institutions, and also in airports and bus stations, and in outside in America and Europe, they all have these incinerators for disposing the sanitary waste. And for men also, men may think that we are doing only dressing, only that gauze. What about the condoms being used? They are also made of silicone. They also need to be wrapped in tissue paper and thrown somewhere. Where? In the dustbin with covered lid. So not only the girls, the boys also have to follow it, because this again goes to the incinerator. We have biomedical waste. I'm sure you know. Waste is different. You have a solid waste, a liquid waste, a biomedical waste. Each of these goes in separate bins, and separate plastics in separate bins, and each of this is put in the incinerator. So hospitals do have, but other institutions, I'm sure we are lagging there, but we have to come up with this to dispose also. And others collect it and dispose it as biomedical waste. Like in our colony, the colony that we stay in, railway colony, our trucks come and we have to give it in different bins. Then they take it away. But nobody is so fortunate that it will come like that in every colony or every place. So take a bath at least once a day and wear clean cotton undergarments and change frequently. Cotton is the material, go-to material. And even in napkins, cotton is best, and even in clothing, that is important. So what is the effect of the poor menstrual hygiene? Suppose you do not take care of this hygiene, you will have reproductive tract infection. Important for all the girls here. Why? Because one day or the other you may get married, then you need to have children, and if you have reproductive tract infection, sometimes you may be unable to conceive. That is called infertility, because the tubes may become blocked with infection. So reproductive tract infection is one. Urinary tract infection, that we all know, suffer also sometimes if you don't take adequate water, or you're holding your urine for a long time, not going to the toilet. Then pelvic inflammatory disease. What is this? This is nothing but the infection of the pelvis, or the lower part of the abdomen. So how do we get this? From this same menstrual hygiene, if we do not do properly, the bacteria virus will go up the cervix to the uterus, and from the uterus they go through the tubes, the fallopian tubes, you all know, and from the tubes they go to the abdominal cavity, the lower abdominal cavity. It is called the pelvis. So the infection comes there, and what happens? The tubes get blocked. So that again, when you're trying for pregnancy after marriage, then if the tubes are blocked, you will not be able to conceive. So that is also important. Then toxic shock syndrome. This is a lethal disease. I've mentioned it here because it has a relation to tampons. Those of women who use tampons and are not changing frequently, that may lead to this condition, because when the tampons are there, they invite a very bad bacteria called Streptococcus pyogenes, group A Streptococcus, and Staphylococcus aureus, which will cause very high grade fever in the patient or the child or lady, and very high grade fever with chills. Then you'll have nausea, vomiting, then fainting, dizziness, then have a rash all over the body, and sometimes you go into shock. Shock means all your blood pressure will drop down, your pulse will increase, the kidneys stop functioning, the heart and lungs and the brain gets affected. So it's a very serious lethal condition. That time you need to be treated immediately with IV antibiotics, then IV fluids, and also other drugs to improve your blood pressure. So that is one problem with tampons. And also if you have very bad ulcers or burn cases, always we need to be dressing. That's why we do dressing, so that infection does not come and lead to this bacteria and cause these diseases. Then infertility, you know, means inability to conceive. So poor menstrual hygiene lead to PID again, so blocked tubes may not conceive. Okay, so everything is related. And then infection of the cervix with HPV. HPV means human papilloma virus, and that may result in cervical cancer. So this we can prevent by using HPV vaccine. It is important to prevent not only cervical cancer, also vaginal vulval cancer and anal cancer and genital warts in girls and women. And even the boys can take the vaccine, because it will prevent penile cancer and anal cancer and genital warts. So this vaccine is available. So we should take the advantage of this vaccine. No other vaccine is available for ovarian cancer or for breast cancer. It is only available for cervical cancer. So how many of you have taken HPV vaccine? May I see your hands, please? Have you taken your vaccines? No. You should have started. We are all giving to 11 to 12 years old girls, especially who have had not intercourse till now. That is the time when it works best. Before sexual exposure, that is the time it works best. But even if you haven't taken it, you must take it. Up to 45 years it is available. So there are two types of vaccine. One is called the Gardasil, that is 4-valent vaccine and 9-valent vaccine. 4-valent means it will protect you against 4 strains of the human papillomavirus. And nanovalent means it will protect you against 9 strains of the vaccine. Like all of you have taken vaccines, I'm sure. 90%, 99% will raise their hands. You have taken your COVID vaccine, because there are different strains in COVID vaccine, in like Omicron, Delta, Alpha, this, that. There are also so many strains here. There are a lot of strains here which cause cancer, some may not. So now we are giving, in gynae OPD, we are give to every child who's coming 11 to 12 years, we at least advise. The only constraint was the price, which was high. Gardasil was around 4,000 rupees earlier. Practical points. And now one vaccine again has come. It is called Surveyvac. That is cheaper, half the price, 2,000 rupees, but from 12 years up to 26 years. So if you are in this age group, you must take the vaccine. The 3 doses is must. Number 1 dose, suppose you take today, you take after 2 months, and you take after 6 months. These 3 vaccines will protect you for life against cervical cancer. Not only girls who have had a history, mothers, grandmothers having cancer, but all of us who don't have any history also, you must take. Okay, so it will at least protect against one cancer when there are so many cancers occurring, right? So if we don't have vaccines for the other things, we have at least one vaccine here which we should be able to use. So the 2 kinds of vaccines, up to 26 years you can take, both boys and girls. And the other one, which you can take up to 45 years, is the one, the Gardasil one, okay, the 9-valent one. And lifelong immunity is important here. So there are other vaccines also, which girls must take, which I'll have to tell you in a different class or whatever, because rubella vaccine, MMR vaccine, influenza vaccine, there are so many vaccines that need to be taken. We'll go in for that later. Then strategies for management of menstrual waste. Now, if you're encouraging so many to use the products, what about giving them the opportunity to dispose of the materials? So how do you do that? So obviously there should be separate toilets for men and women, in whether institutions, schools, colleges, okay, in airports and shopping malls and everywhere. Then women toilets should have sanitary napkin vending machines, which can be operated on payment. There should be separate collection system for the menstrual waste. Dustbin should be covered with lid. And I'm happy to say that only today when I was making those slides, I remember that when I was in school in Holy Child and St. Mary's, and I studied in St. Loreto in Calcutta, we had nuns, missionaries teaching us. They had taken a class in class 4 or 5 itself regarding menstruation and menstrual hygiene. They taught us how to use the pads correctly, because some girls at home have not been taught by their mothers. So they used to teach us how to use the pads, how to dispose it properly in the bins which have been kept in our toilets, how to close, and also have compassion for the woman or the cleaner who is disposing such products. So it is not good to just throw it away. You must wrap it in paper or whatever, and then only put. So I remember now when I was making slides, then I remembered that the sisters or the nuns, they had taught us in class 4 and 5. And then again, when we were in class 10, they took classes for us regarding menstrual hygiene and also in sex education. So that when they are preparing us for life, when we go into college, class 11, 12, you know, and further, what is menstruation, how does fertility occur, how to avoid fertility at this time, and how to take protection, and how to prevent infections, all on usage of condoms, etc. have been provided, or have been, that information had been provided to us by the sisters, because even we were apprehensive about talking all these things with our parents regarding the sex education. Yes, we did learn about menstruation and how to dispose products from our mother, but not the sex education. But that was given in our schools, which I feel is so important nowadays. The class, moral science class was there for us. Only now I'm reflecting on that when I made this. Then ideally there should be availability of water, toilet paper, dustbin and wash basin in every institution. Proper safety tools should be provided to the cleaners. Now, what are the government schemes in the rural areas? In the urban areas, our biomedical waste has been taken by dustbin, by these big trucks. We are wrapping, putting off our garbage, and they are taking. But in rural areas, under the aegis of National Health Mission, we have a National Menstrual Hygiene Scheme also, which was adopted in 2014. Whereby there was distribution of free napkins, sanitary napkins to all the schools in the area, the government schools in rural areas. And others, they used to charge 1 rupee per pad. So that was also very good for, in rural areas where they cannot afford such other expensive napkins. Then NGOs and self-women groups, they were taught to make napkins from locally available materials like cotton fiber, wood pulp, coconut husk and bamboo fiber. Now, the beauty of the products is that they are biodegradable, which means they're environmental friendly. So you take from nature, you're making from nature, you use it, give it back to nature. Because they are biodegradable, even if they go into the soil, they will not pollute like a plastic. A plastic is actually not good. The plastic that we are using is not good, isn't it? Because it will not degrade in the soil, may stay for 500 years, who knows. So these biodegradable things can be again, recycled. So that leads to a more greener environment. We are talking about climate change and green. This is also one way we ought to do this. So they are taught to make the materials and make it available locally at very small, very cheap rates, or maybe even free. So that is why in the rural areas in this past decade, we have seen an increase from 20% to 48% users of sanitary napkins. And in the urban areas, it's around 80%, 77 to 80%. Then Swachh Bharat Mission, some have been sweeping compounds of the school, some are sweeping the railway stations. This is also Swachh Bharat Mission. Under that mission, we have provided, the government has provided us incinerators using electric current or battery operated in schools, in South India mainly, and also in North India and Western India. And there are clay incinerators also, which I will show you the photo, then you will remember. This is a pad vending machine, nappy vend, and many such things are there. I'm sure some of you have seen this machine also in malls, shopping malls, and big international airports you have seen. But it is yet to come in all the bus stations and railway stations and all schools, and it should be there. With a minimal, you insert a coin there, then you get a pad. So that is number one. Then to dispose it, we have that second picture that you see with two smiling girls. That is the incinerator. A small incinerator given by the government of India in the rural schools, because per day suppose 7 to 8 pads can be fitted there, can be, the heat is given there in that incinerator, about 800 degrees and above. So there are two buttons there. Once you start, then it starts burning. There is an exhaust pipe that goes out. Carbon dioxide probably goes out, and once the thing is done, then there is an automatic switch off, means to know that your process is done. And the ash will come out through another tray, which you can easily dispose. You can dispose the ash and make it fertilizer for plants, or you can even, they are making some paper out of it, wood pulp. They are making wood pulp and making paper out of it. So again, the cycle, recycle thing is important for us to save our environment. And this machine is available for 7,000 rupees onwards up to 30,000 rupees only. So an institution can always afford it. Then it is noiseless, it is odorless and environment friendly. So less pollution goes into the air. Then this is solar sanitary pad incinerator, the world's first, developed in India. It is developed in the very hot regions where there is so much of sunlight. Then you can use the solar power to, use these pads and incinerate them. So that is also a good invention by these NGOs and these ladies. And can you see the picture on the entire left? That is a clay incinerator. Believe me, I had not seen one. I have not yet seen one personally, but it is available in the rural areas. All the NGOs and ladies, they make it with mud and clay, and the bottom hole, that is where you put the fire in. The top hole is where you put the menstrual products in. And in fact, if you have anybody you are dressing at home also, you can dispose the gorgeous there. And the ash comes out at the bottom tray, if you have noticed. So this is a very cheap, affordable thing that they can make in the rural areas. And the women are using it for their day-to-day purpose at household level, at the block development level, in the community level. So really appreciate to see this. They're using, at the same time they're disposing it so nicely, rather than just throwing it off in the field or somewhere. And that may lead to some spreading of infections, maybe hepatitis, maybe other infections, but not HIV, because HIV cannot be spread like that, because it's a very labile virus. It will, as soon as it comes in contact with the heat, then it burns, the virus dies. So HIV is not spread like that, but some kind of other infections may come. So see, the ladies there are using under Swachh Bharat mission. What is the role of boys now? Here towards menstrual hygiene management. Not only they should take the cancer vaccine, which I have advised the boys also, but they should provide physical, mental support to the girls and the women. They can construct toilets, incinerators, and latrines with chutes at homes, schools, and the community level. At household level, they can help by providing toilet facilities with privacy, with water and soap, and by providing financial support for buying menstrual products. Males in rural areas tend to buy more gutka, not only in the rural areas, even here. They will buy gutka, cigarette, which will harm them. Rather use that money for that, instead of the gutka, you can buy 1 rupee pad, So they can help by doing so. In India, a man named Arunachalam Muruganatham, known as India's padman, which I think Professor has already mentioned. I developed an inexpensive and environment-friendly machine which produces semi-biodegradable sanitary napkins. And that movie was made, which Sir mentioned, with Akshay Kumar and Radhika Apte in the lead, I think. And that was to bring the awareness about this menstrual awareness, and also the menstrual hygiene, and that the pad should be used. That was the message. Also, I believe one movie was made that the name was Period. End of a sentence, but I don't know who made it. One lady made that movie, and it got Oscar. It received an Oscar because they showed the taboos and myths associated with the menstruation, and how the girls in rural areas of India had to drop out of school because of the pain or whatever, because they could not go to school. They dropped out of school, and they dropped out of work also, which means you're at one hand you're trying to improve the literacy of the girls. You're trying to encourage girls to go to school, but they are dropping out there. So we are failing somewhere, isn't it? We are trying to improve literacy, improve karo, but what happens is they drop out of school. And even women workforce, if you do not provide these facilities to them, they will just drop out of work. And once they drop out, you lose the manpower, the women power rather. So in every way, in every economic way, if you see, something or the other is being affected. We are holding back. We don't talk about menstruation. We are holding back. But something or the other affects, and it contributes or does not contribute to the economy. So it is our duty as women to talk more often, so that we can influence our policy makers or ones in the government who are in social positions of power, who can bring more changes like this, like they have done in the rural areas. Bring more missions, or advocate some schemes for women. Then only we can take the whole nation forward. And the role of teachers. The first teacher is, of course, the mother and elder sister or the masi. But we have teachers also in schools, as I had mentioned just before, when my nuns had advised us on what to do and what not to do. But in schools, teachers can make the school environment girl and women friendly to manage menstruation with dignity. Teachers' attitude, school environment, and infrastructure is essential for maintaining proper menstrual hygiene. Otherwise, many girls may remain absent during this period. Teachers should educate girls about menstrual health management and its link to their general health, disposal of menstrual waste at home and school environment. So awareness about menstrual hygiene leads to a better reproductive health, greater self-esteem and confidence, better academic performances, better professional achievements, and also who are homemakers for better household management and child care. So the take-home message today is periods are a sign of good health and fertility. So I encourage you on this special day of World Menstrual Hygiene Day to take care of your health and also your menstruation days, which are special for all of us, and so that together we can all go forward, be a period-friendly world, as Madam had said. That was the theme, I believe, or theme or the slogan for this year, 2024, so that we can all go forward with this. So thank you once again. Thank you very much for such a patient hearing.
Listening to you was quite an honor. We definitely gained abundance of knowledge on the topic.
Hello ma'am,
Now-
my name is
Hello.
Afrida Julfi. I am from second semester BAJMC. Ma'am, when I got my periods, my mother tell everyone, like my jethai and everyone, that I have got my periods. My first advice that my jethai gave, don't eat sour foods like pineapple, like this type of food. I have a question, why in periods the girls can't eat sour food?
They can take. We don't have anything in science that says you cannot take sour food. Vitamin C, vitamin B12, vitamin D. Why did I say lemon water? It has vitamin C. So the scientific basis that all the studies have been done now. So all this vitamin C can be taken. Okay. So not sour food, I won't say, but because of sometimes maybe gastritis, because they have nausea, they have vomiting during periods. Okay, and if you take too much of heavy and rich and oily food, because of the PMS symptoms, remember I told you? Yeah, so if you have that kind of bloating feeling, gastritis, or so that time what happened, nausea feeling, that time you cannot take, not cannot, but not advisable to take. Why? Because you may again vomit having all that. But there is no scientific relation saying don't take vitamin C or sour food with this, according to all the studies that we have got. Okay.
Ma'am, my question is, what was your first period experience?
Well, I had been prepared, sir, in zoology. So she had a science person, she had prepared me already, saying that this is so, this happens. And that's like I'm talking about 30 years back. But being probably I was lucky because she was a teacher. She's a professor of zoology, so she told me beforehand, so this may occur when I was in class 7, I think, yeah, or 6 probably. Then she told me that this may happen, so you should be prepared for it. This is natural, nothing to worry and nothing to fear. And if you have any other problems, you please tell me. We are all there to support you. So for me, it was lucky. I would consider myself lucky being having a mother like that. And secondly also, my mother never had these taboos, never ever followed taboos or myths. Like touching, as I told you, don't touch this, don't touch that. We were a working group of people at home, so we all had to work in the kitchen. They would say, in some households, my friends, they would say, don't go into the kitchen, don't touch that, don't touch this. Never in my house, because my mother was working, she did cooking, we never had some household help that time, permanent household help. So I also had to wash and I had to cook, and even my mother, we helped mother in cooking. So we did not have that environment in our house. And the scientific basis, I feel, for some people, because when they have too much of pain or, feeling irritable or drowsy or some kind of symptoms, PMS symptoms that we all now know, then they need to take rest. Some needs to take rest. I think the rationale behind it was that in the old age, that women used to do a lot of household work, and even in the fields they used to go. So maybe they were given rest. during those days. Don't go, don't do this. When I think they were not, they had to work day and night in the kitchens. So probably they were said these 5 days don't need to go to the kitchen, so that you don't need to work. They will get some rest. So I feel probably that may have been a reason for giving them rest. But nowadays, if you feel that it is a part of you, isn't it? It's a part of everyday life, and we need to go forward with it. And if you have trouble with during a period, then you must consult a doctor and try to get relief from it, because it is now open and you can easily discuss also. But from my experience, I was lucky, I would say.
We are not supposed to wash our hair with shampoo the first 3 days. So is that true?
When you do your hair wash, there is stimulation of some hormones. Okay, the pituitary gland, some kind of stimulation may occur, so that leads to the hormone, and that's why the period occurs. Actually, everything has a scientific basis behind it, but that is the reason. Some women do have. Once you massage your head, and wash, then you may have the period during the period days, not like in the other days. But suppose you're going to have a period 1 or 2 days later, then it may happen on the same day. So because of the hormonal thing, it does happen.
Ma'am, my question for you is, it is said, and many times it has happened with me as well, that when someone near or next to you is having their periods, you also get it on the same time or almost on the same week. So ma'am, is there any scientific explanation to that? Why does it happen?
No, not at all. It does not happen so, because it is nothing contagious that you are going to get it from your friend or anything like that. It depends all your hormonal cycle, your level of estrogen, your level of progesterone, how it is acting. So it depends on that actually. It's all hormone dependent. And also because of anxiety, as I told you before, anxiety, stress, some kind of physical activity, that may also lead to that. So nothing to do with sitting side by side, having contagious or something like that.
I think it's psychological. What she said, I experienced in boarding school sometimes. So even I used to feel, I used to wonder why, but now I feel maybe it was psychological.
We haven't explored that yet.
It does happen with me recently actually. My friend also had her period, so I got it at the same time.
Yeah, but how many days did you, before that did you have your period?
Ma'am, I think 20 to 21 days before.
That's a normal cycle. 21 to 30 days is a normal cycle. In fact, up to 40 days is also a normal cycle. So anyway, you were due for it. So, but every 15 days you are having, or every 10 days you are having, that I do not think will be right. Yeah, helps. That's yeah, the hormonal thing.
Normal, or we need to go for any medicine or like that?
No, toothache.
It happens. It is my wife, my better half, I'm telling. Normally what happens just before the period, 4 to 5 days before, she is having some toothache, then that toothache will lead to headache, and she'll have for 2 or 3 days, she'll have to go for 2 to 3 medicine.
Some kind of painkillers. But headache is associated, yes. Headache is associated. As I had said, it is a constituent of premenstrual syndrome. So nothing with the toothache. This is the first time I've heard about toothache. But headache, yes. Nausea, yes. Bloating, gastritis, then pain, back pain, then breast pain, then hand-feet pain. All these are related. I don't know about the tooth exactly.
But it's quite common.
Yeah, these pains, headache is quite common. Headache is quite common.
Is it advisable to take these painkillers or the...
For abdominal pain, we give the painkillers, and sometimes migraine, if a patient has migraine, that may be related to the cycle, because that is related with hormones. Migraine may be related. Thank you. Okay.
Hello. She used to have her periods regularly, means it's quite normal, every 5 days, every month, but she has problem when she got married. She had problem in pregnancy. 3-4 years till now she is not pregnant.
Right.
Means what's the problem? Can you tell?
See, there are a lot of causes for infertility, not necessarily reproductive tract infection. there could be something wrong with her husband, with her semen analysis. It has to be done to find out that out. Then there could be, as I said, reproductive tubes may be blocked. There may be hormonal issues. Is all her hormones, whether they are all right or not. What about her thyroid level? What about her prolactin level? What about her AMH level? So these are hormones of the woman which need to be in balance for pregnancy. Number 2 is your ovaries, whether your ovaries are functioning normally or not, whether they are ovulating every month or not. If not, again, there are medications to ovulate to cause pregnancy. Okay, then there is something called the uterus lining, which is called the endometrium. The endometrium must be of a good width, so that the pregnancy occurs and it stays there. Okay, so there are different factors like tubal factors, uterine factors, then cervical factors, cervical discharge sometimes, okay, and hormonal factors, then infective factors, like reproductive or sexually transmitted diseases, and also other factors. Husband's factor is also one factor, because only one cannot have a problem. No, we have to address both the husband and wife when we go for infertility issues. And there are other things also, depending. Stress is also one factor, overwork, overburden. Then ovulation time needs to be taken out. So for each woman it is different. So only after talking with the patient, taking their history, counseling, trying to find out if they have any medical disorders, hormonal issues, infective issues, blockage issues, husband issues, then only we can say that yes, okay, we have identified this is the root cause of their infertility, and this is how we go about it. Either we have certain procedures, operative medicines, or operation to correct it, or nowadays you have heard of IUI, intrauterine insemination, or IVF, that is called in vitro fertilization. Okay, so where you can process this entire sperm and egg fertilization outside the body and put it in the uterus. You can go for IVF too. So just what is the cause for infertility will be a long list of things. So we have to approach the couple and then find their issues, find their causes, then only go for the treatment and give them the best advice. Okay.
Thank you, ma'am.
Thank you. I'm very glad that so many have so many questions, especially on menstruation, because otherwise it's a boring topic for all. But I'm happy that they've come. How early do you mean? How many days do you mean?
Prior, or 15 days late.
Or 15 days late. Yes, that is all because of the hormonal imbalance only. So you got to take, judging you from your health, you got to take a good diet, as I suggested, protein diet and a good well-balanced diet, and also go for regular walks. That helps to bring a balance in your hormones. And even if 21 days you are having, that is also normal. If you are having a 35 or 40 day cycle is also normal, because there is a wide range of normality, isn't it? But having every 10 days or 15 days is not normal. That is abnormal. Okay?
Thank you so much.
Welcome.
Mehek from BSc Animation, what semester?
Right.
I have a question that, ma'am, I have read on the internet that during the COVID times, that many of the girls had led to suicide because of the severe pain during their periods. So is it true that it can lead to suicide?
No. I think you're saying that COVID is related to the menstruation?
No. During the COVID times, that many of the youngsters had, because of the severe pain.
Severe pain, that is not the cause for, that should not be a thing for suicide, at least I have not heard about it. Underlying cause are different because of mental. I think the underlying cause will be mental, because in COVID situation you are having either you are suffering from COVID, okay, where you are feeling that you cannot breathe, that problems. The COVID has affected so much badly, isn't it? So physical symptoms may be there for which they feel that I cannot tolerate this anymore, I cannot take this anymore, number one. Number two, the mental tension. Why? Because you're cooped up in a house. You're cooped up in a small room where you have to stay whole day, isn't it? And not going out, not having friends going out or doing any other activity. So if you're cooped up in a place, it's not for everybody. you feel claustrophobic, you feel that your life is an end, you can't go out, you can't do anything. That affects a lot of people psychologically. So many have been affected psychologically during COVID. So maybe that person had something apart from this. That girl must have had something psychological issues around with. If she was evaluated, probably she would have lived to see this day. But she would have to be evaluated. It is she should seek the help of a doctor, or her parents should help her in that sense, because not only physical, mental stress was extreme that time. So there must be some kind of underlying thing which led to that drastic step like suicide. So I don't think it is related to period pain, because period pain she must have had it before also. Okay.
Ma'am, I heard that female bodybuilders and female athletes get their periods like very late, like 6 months, 3 months. Is there any reason for that, or is it?
Yeah, physical activity does have a lesser pulse also. They have bradycardia, female, and they may have periods which are low in nature, and they have less pain, because once you do go for physical activity, you get a good amount of hormones and a good amount of endorphins, very good for the body. So that way their pain, their cycles, they are very healthy in that sense. So that's why I have advised her, a classmate of yours, when she asked about the period irregularity, I advised her, remember, not medicines. I did not advise her hormones. I advised her only for good physical activity and a good diet, because that will also lead to a good menstrual cycle. Basic thing. Okay.
Questions. I'm sure all the doubts have been cleared now, and if there are more questions, we can surely have a different session for another day. So coming to an end, I would request Dr. Rashmi Sharma ma'am, Assistant Professor RSCOM, to deliver the vote of thanks. Please give a huge round of applause for ma'am.
Thank you so much, ma'am, for the lovely session. Why I'm calling it lovely? Because every boy, every girl in the room was very patient, and I'm so glad both the genders came up with their questions, and of course meaningful questions, if you say so, if you agree. And first of all, let me begin with the team of students who took the initiative and organized this meaningful program, and all the boys who supported them. Definitely a double thanks to all of them. And of course, my dear colleagues who definitely supported each and every plan they had for this event. Though the rain played a little spoil sport in the morning, but things are now ending so well, so all is good that ends well. I thank our Honorable Vice Chancellor Sir, our Honorable Dean Sir, our Honorable HOD Ma'am, and Professor Nayak also for their support in every department event, including today's. I also wish to sincerely thank not just the people confined to this room, but each and every individual who is sensitive enough towards these issues of women and are trying to spread awareness on the matter in any part of the world for that matter. Belonging to a place where, belonging to Kamrup, a place where a very important shrine is there that definitely symbolizes this whole aspect of fertility in women, Kamaikha, and we also celebrate her menstruating every year. So that makes it all the more important that we carry on with some such sessions and celebrations, observations in future as well, and then we can have ma'am with us more often, and all the pending questions can come up then. So thank you everybody for this patient hearing, and thank you ma'am for this very, very comprehensive information that you have delivered in a very limited time, which spans from, like women's health and the hazards, the wastage, the recycling, and how men could participate, and everything all together. So thank you so much.